The University of Utah now has a clinic to help treat and study what are often called long hauler cases of COVID-19.
Diego Romo spoke with the medical director of the university's post-COVID clinic. He joins us live now. Diego.
Yeah, Max and Kelly, the University of Utah's post-COVID clinic will be housed here at the University Hospital and will help patients known as COVID-19 long haulers connect with specialists to help figure out treatment plans moving forward.
We want to take these patients seriously and listen to what they have to say and support them through their post-COVID journey as well.
The post-COVID clinic will focus on two sets of patients dealing with the long-term effects of COVID-19.
The first is patients that were sick enough initially to be hospitalized, and some of those even required ICU care.
Dr. Brown says roughly 1,600 people were hospitalized at the University of Utah with severe cases of COVID-19 over the course of the pandemic. Those patients will be connected with specialists at the hospital's physical medicine and rehabilitation clinic. Patients who had milder symptoms while infected but are still dealing with long-term issues will get connected with a care coordinator for primary care at the University Hospital.
We have a way for them to see subspecialists as needed through either e-consults or actual clinical visits.
Treatment plans for patients will be decided on a case-by-case basis depending on the individual's symptoms. COVID-19 long hauler Lisa O'Brien says she is excited to get answers to questions she has been asking doctors for the past year.
It's been a long wait for this. There are so many people that are in dire need of this program.
O'Brien says one of the biggest struggles with her post-COVID journey has been inconsistencies in her treatment plan.
You know, we'll have people say, well, my neurologist told me to do this, but my cardiologist told me to do this. And they're two completely different things. And so that can get a little confusing.
The clinic will allow specialists to connect and communicate with each other on what treatment plan will be best for a specific set of symptoms or needs.
It allows us to share experiences and say, hey, this worked for this patient. This is a possibility that we could try.
The clinic will also provide doctors and researchers the opportunity to learn more about post-viral disorders, like chronic fatigue syndrome and its effects on the body.
Patients have been affected with COVID. Many of them are very altruistic and are very interested in research, not only just to help them, but to help other folks who have suffered with COVID.
Now, Dr. Brown says the clinic plans to open its doors on June 1st. More information on how you can get involved can be found on the University of Utah's website. We'll link you over there at fox13now.com. Live in Salt Lake City, Diego Romo, Fox 13 News, Utah.